as it happens to every content creator at some point in their career, I filmed a full first video aside from the one that you are about to watch, and I don't know where it went. It's gone into outer space somewhere. I tried to recover it. The file was corrupted or something like that. So let me just get you a little bit caught up to speed as to what's going on so that when you watch this video, things make a little bit more sense. So starting on June 13th, I called my doctor's office so that I could get my IUD taken out. When I went to get it taken out a month later, on July 8th, she couldn't find it. And when that happens, it either means that the IUD has shifted positions, sometimes the string was just cut too short, or on rare occasions, it can actually become embedded on the inside of the uterus. I then had to book an internal ultrasound so they could figure out where my IUD was. And she also sent me for some blood work. And I'm a little bit bummed because I filmed that whole process with you guys and I kind of shared my emotions as part of the experience. And I bought, I took you guys along while I bought pregnancy tests and ovulation tests and all that kind of stuff. But I'm glad that part of it is still here. So in this video, you will see a little bit more in regards to sort of how I prepared my body, how I have been preparing my body for pregnancy. And this is only the beginning. This is only the beginning, you guys. I am going to film this entire process with you guys from, honestly, now until I someday give birth and beyond that, hopefully. So if you are interested in following along on any part of my perinatal journey, even if it's just preconception, if it is pregnancy, if it's postpartum, if it's delivery and birth prep and all those kinds of things, make sure you subscribe so that you are kind of part of that story with me, because that's really the goal, is to just share my journey so that those who are also going through it or may one day go through it can sort of have a real and raw experience to draw from. So that's kind of Cole's notes, a little bit of what was supposed to be in the previous video, and I'm really sad that it's not there because, like I said, I filmed everything with you guys, and so I'm sad that I don't have that video anymore, but I do have this one. And this one is arguably more important because this is the one where I actually get my IUD out. But anyways, enjoy the rest of the video. So I literally just walked in the door from walking Cooper, and I figured since now this is kind of like a pregnancy prep situation that's going on in this video rather than just IUD stuff, I want to show you a couple things that I ordered. So NYX was having a massive sale. It was like 50% off, and I ordered 3 pairs of leak-proof underwear. So I'll show you just one of the pairs, but so these are super leak-proof. And these are incredible for postpartum. I recommend these to my postpartum patients all the time, or my pregnant patients. And they are, okay, let me just show you. So I got like the high-rise leak-proof. What are they called? They're called super leak-proof high-rise. I'll just show you that there. So super leak-proof high-rise. So they look a little bit like granny panties, but that's kind of the point for postpartum. So for postpartum, we have this nice area here that's really gonna hug the tummy. And we have on the inside essentially a pad on the inside. So that is the pad on the inside. It's actually quite thick. Like, it's actually super thick. I have a couple lighter absorbencies. I don't have a super, but I just think that these are going to be really great for postpartum. Instead of wearing those like essentially diapers, like those adult diapers, I feel like these might be a lot more comfortable. They might give my tummy a little bit more support, all that kind of stuff. So I ordered the purple. I got, I think, oh, this one's like a fun, just like multicolor. These are so cute. So there's those. These are so fun. I should have got so many more of these. And they're all the exact same. They're just different colors. And then the last one is like a really pretty like slate blue color. So that's those. So I honestly think these are going to be incredible for postpartum. I have a couple pairs already that are like a lighter absorbency, and they just don't come up quite as high on the tummy. So I'm hoping that these will be good for that. So I'm really, really looking forward to being able to use these even like later in pregnancy, if I don't know, if I just want a little bit of extra support, or if I just, I don't know. I feel like I'm just gonna love them. So those are the NYX underwear. I do have a code if you'd like to use it. That's not why I'm showing this to you, but if you are also interested in purchasing some leak-proof underwear for postpartum, I do have a code that saves you 15% off on your order of $120 or more. So I will put the link for that below, and I'll also put my code below. My code is subject to change. It changes every once in a while. So if it's not working, please message me and ask me, and I'll send you the new code, because sometimes I forget to update it. Next, we got this package, and I think I know what this is. So, it is what I thought it was. Okay, so in here, this little box, I have a liver cleanse. This is by Alpha Science. It's just a regular old like milk thistle liver cleanse. And one of my friends, her name is Marla, I can tag her accounts below. She recommended this to me. She did this before she got pregnant the first time, and she was like, yeah, might as well do it. I checked with my naturopath. She's like, sounds great. It's natural, so it's not going to do any harm. But my naturopath was like, yeah, no issues at all with doing a liver cleanse before getting pregnant. So that's what I'm going to do. So I go into this pregnancy as healthy as absolutely possible, especially because I have a little bit of time. I have some time now. I have a good like month and a half. Actually, a month from today exactly is when I get my IUD out. So this will be nice to do beforehand, so my body is in tip-top shape before I get pregnant. I don't know what this tastes like though. Okay, let me see. First of all, let's see if I can open it. I'm a little nervous that it's just gonna be super gross. Okay, I hate when they make the tops like this and like you can't pull them off. You have to like stab through them, you know? Oh, it smells disgusting. Well, you know what? Let's make this a little fun. You guys can be here while I try this for the first time. Do I have to shake this? Shake well before use. Okay. I feel like I should have like water ready or something. Okay, it said two tablespoons or 2 teaspoons? 2 tablespoons. All right, well, let's give her a try. Ew. Oh, gross. Okay, well, we're just gonna do it up. Oh, it like lingers. It lingers. Oh, all right. Well, the things I'm doing for this unconceived child. I will continue to consume, and hopefully it'll make me feel good. And I guess we will see what happens over the next little while. I got my ultrasound results back, and I want to go through them with you guys. But this calls for celebration, so we are drinking. This is a delicious peach Bellini sparkling drink. I found these at my local, I guess it's like a fruit stand market kind of thing. And essentially it is a sparkling drink that's made with honey instead of other sweeteners. It's made with real juice, it's gluten-free, and it doesn't have any preservatives. So I actually haven't even tried this one. This is the, like I said, peach Bellini. Ooh, that has a really strong flavor, but it's delicious. Oh my goodness. I don't know if these are just local to where I live, but if you have access to these, go get yourself some of these. I also have a mango one in the fridge, not in the freezer. A mango one in the fridge, and I'm excited to try that one too. Oh, that's delicious. Okay, so I got my ultrasound results back, and I'm gonna go through them with you guys. So the purpose of the ultrasound was to determine where the IUD is. That was the intention of the ultrasound. So I got both a pelvic and a transvaginal ultrasound, so external and internal. The wonderful benefit of working as a healthcare practitioner in a physio office is that I can actually request all of this stuff myself. So I don't have to wait to go see the doctor to request it. I can just do it myself at work. So it says the IUD is noted in the endometrial cavity in expected position. That's really the most important part. So first of all, it's in there. That's what we wanted to know. And second of all, it's in the expected position. So this means basically when my gynecologist put it in, he just cut the strings too short. So it's exactly where it's supposed to be. My doctor just couldn't take it out because the strings were too short and she couldn't find them. So that's the first thing that's really exciting to know. Second thing is it says endometrial thickness is normal at 4 millimeters. The other thing it says is there is an echogenic focus in the left ovary measuring. So echogenic focus means like it shows up that there's something there on the ultrasound. In the left ovary measuring maximum of 2 millimeters, which may be a dermoid. A dermoid is essentially like a cyst. This is not totally abnormal for me. And like totally out of the blue. I have had ovarian cysts in the past, and I've actually had a few burst in the past. So this is not necessarily new, but this is the first time I've had it like verified on imaging that I have had them. It says right ovary appears normal. My adnexa is unremarkable, which is essentially like the connective tissue that is between my ovaries and my uterus. And then it says impression, which is just like a sum of everything. It says satisfactory position of the IUD, possible small left ovarian dermoid. So we're not going to worry about the potential cyst as long as it's not causing me issues. I don't think that's something that needs to be worried about at all. So that makes me really happy. So that's why we are having a nice little bubbly drink, because I'm really, really excited about that. That is very good news to get on a Tuesday. So I have to wait a few more weeks until I get my IUD out, but cheers to a happy uterus and hopefully a hospitable one. And hopefully they can just take the IUD out promptly and we can start trying to have a baby. We're still doing it. It still doesn't taste good, but how much do I have left? That much. I have that much left, so I can do it. I can muscle through. IUD removal is tomorrow. Tomorrow, 8 a.m. I would be lying if I didn't say I'm very, very anxious. I'm just excited for it to be done. Also, a little tip, if you're gonna do this liver cleanse, don't drink it after you brush your teeth, because it's not good on its own, and it's really bad with mint. Okay, I'm gonna go to bed. I hope I'm gonna be able to sleep a decent amount, but I have a feeling I'm going to be a little restless tonight, but yeah, I will chat with you guys in the morning. All right. The baby blocker is out, you guys. I just got it taken out. It was so fast. I was going to film it. Here's the thing. I had my phone in my hand and I was going to film it, and I was fumbling getting the video ready because the receptionist was also in the room, like she was assisting, and she asked me a question about if I'm going anywhere this summer, and I got distracted, and before I even got my camera ready, you guys, it was done. That's how fast it was. I feel so relieved that it's done. I don't have to worry about it anymore. It feels so good. It feels so good to have that out. Okay. It has been 4 days. Wednesday, Thursday, no, Thursday, Friday, Saturday. It's been 3 days. 3 days since I got my IUD out, and I wanted to wait just a little bit so that I could kind of share with you guys what my symptoms were like, what I experienced after the fact. Right now I'm drinking a almond milk hazelnut latte with some cinnamon, and I just filmed a get ready with me video, so that's why it's half gone. Yeah, let's just get into it. Okay, so for starters, there are very few OBGYNs in my area. There are very few. There's actually only 2 in the town over from me. Other than that, there's a handful that are in Windsor, which is like 40 minutes away. I had to wait 2.5 weeks after my ultrasound to get an appointment to be able to take my IUD out. My appointment was at 8 o'clock in the morning. I had to go to work after, so I was a little nervous that I was going to be in pain while I was at work. So I brought some Advil with me, or some ibuprofen, 800 milligrams of ibuprofen before I went in. I waited probably 30 minutes and they just let me go straight into the room, and I waited approximately 30 minutes for him to come in. There was just a lot of like administrative stuff that was happening, and I also do understand I was there at 8 o'clock in the morning, so that's like right when he was starting, and like the beginning of the day is always a little bit chaotic and stuff like that. So essentially, the receptionist, who is also, I believe, the clinic assistant, she brought me into the room. She took my blood pressure, which was pretty decent. It was like 125 over 70 or something like that. It was a little high from what it normally is for me, but it was still fine. So she did that, and then about 15 minutes later, she and my gynecologist came into the room. She was right up by my side, kind of giving me some support, like rubbing on my arm and just like encouraging me through the process, which I thought was wonderful. I did not have that for the insertion, so it was wonderful actually to have her there to just be like, you're doing fantastic, like just take a deep breath, like those kinds of things. So that was really, really good. They both came into the room. He asked me how many kids I have. I said none. And then he said, oh, so we're gonna start having kids. And I said, that's the plan, yep. And he was very excited about that. Started the way, I'm sorry, my nose is so itchy right now, and I don't know why. I did not do drugs, I promise. So we started the appointment, you know, when you're up on the table, they're like right down in your business, and they're like, okay, move a little closer, scooch closer. And he just kept saying, he's like, yep, right to the edge. And I'm like, there is nowhere for my bum to go. Like you, trust me, you are right there. Like you can see everything very well. So speculum was inserted, as usual. The part that I was the most nervous about pain-wise was the little grabber clamp that like looks like a stag beetle. Like it's shaped like this, and it like clamps this way. I'll put a picture. I don't remember what it's called. I talked about it in my IUD insertion video. I remember from getting it inserted, that was the most painful part, is that grabber clamp that they clamp on your uterus. That is the most painful part. I actually saw the tools that he had, which was very comforting because it was literally just a speculum and a surgical clamp. So that was wonderful. Sorry, Cooper's just having a dream. He's running somewhere. Don't know where he's going. I think I've said this like 50 times, but speculum was inserted. Now, because the IUD was exactly where it needed to be and it was not in any sort of different position, essentially all he had to do was go in with the surgical clamps into my cervix and then pull it out. So it was, that part was, there was a lot of pressure. It was quite uncomfortable, but it was so extremely fast. It was so fast. I honestly, the clinic assistant or the receptionist, she asked me what I have planned for the rest of the summer. And so I was telling her that we're going on a quick trip to Atlanta in September. And she was like, oh, why are you doing that? And then I felt like a pretty quick, intense pressure. And I was like, ooh, we're going to a baseball game. She's like, you're doing fantastic. Who's playing? And I was like, the Blue Jays. And at this point I have my phone, my phone the whole time. I was just kind of holding it here. And at this point I'm like, oh crap, I need to film my face. Like, I want people to be able to see what my face does. And so I pull my phone out, and from the time it took for me to open my phone, go to the camera app, it was done. Honestly, as soon as I pulled my phone out and I was about to start filming myself, he holds up my IUD attached to the clamp and he's like, look, it's out. And I was like, what? That was so fast. I was like, already? Okay. And I guess clinically, I asked one of my nursing friends, and clinically, I guess they're supposed to show you that they have taken it out, because there are some people who will accuse them of not actually taking it out. And so yeah, so he showed it to me and I was like, wow, okay, that was really quick. And then he basically just said, good luck with conception, and he's like, hoping to see you soon or whatever. And then they gave me some wipes to clean myself up, and off I went. And that was honestly, that was it. After I came out of the room, I went up to reception. I said, is there anything else you need from me? And she said, no, you're all good to go. And then my gynecologist came up and he shook my hand and he was like, well, good luck, I guess. Maybe we'll be seeing you soon. And I was like, yeah, that would be great. I should also mention too that while he was removing my IUD, the receptionist was like, oh, she works at the rehabilitation clinic. And he was like, oh, okay. I communicate with him all the time. We share a lot of patients. I see a lot of his patients. He refers them to our office. I send him a lot of assessment reports and discharge reports and stuff like that. And he was like, oh, I knew your name from somewhere. And I was actually wearing my my clinic shirt because I was going to work. So I'm now 3 days post removal. The day of, I experienced quite a bit of bleeding, and I did wear my leakproof, my NYX leakproof underwear, and I'm really glad I did because I actually had quite a bit of bleeding. Now, I was also ovulating at the same time, and during ovulation, your cervical mucus or cervical discharge is very, very mucousy. Like, it's very, very sticky. And so it was like weird, sticky, bloody discharge for a few hours after. I had a bit of cramping afterwards, kind of like throughout the duration of the day, but I would say when it comes to the scale of period cramps. I've experienced probably level 10 period cramps. This would have been like a 0.5, like a little bit of cramping, the teeny tiniest little bit. I think maybe it went up to like a 2 out of 10 for a short period of time. But again, I just popped another ibuprofen and I found that that was pretty manageable. Even now, so today's Saturday, I got it removed on Thursday. Even now I'm noticing a little bit of, tiny bit of spotting. Like when I wipe, it's like the teeniest tinge of pink, but no bleeding whatsoever. So just like that tiny bit. And I think that some of that is just like residual. And it's also now my body is, and also now my reproductive system is sort of figuring out, what do we do now that this instrument is no longer here? So I think that that's part of it as well. But other than that, I feel perfectly fine. I feel like nothing has changed. No cramping or anything like that kind of resided into Friday. I just had it Thursday, and even by the end of the day Thursday, I think it was pretty much gone. So yeah, that has been very good. Now I did take a really short little video of my IUD. I had to take a video of it in the garbage because I wanted to see what it looked like up close, and it was already in the garbage at this point, but I did take a video of it in the garbage. I'm gonna put that video right here. Here's a warning for all of you that might be a little bit squeamish or might not want to see blood or anything like that. There is some blood on it. So yeah, in 5 seconds, we're gonna put that little video up here and you can sort of see what it looked like when it was in the garbage. It is smaller than I remember it looking. I remember it being a little bit bigger, but in my IUD insertion video, I did talk about how big it actually is. It's only an inch tall. So the whole thing is literally only like that big. So yeah, that's what she looked like. And I'm happy it's out, and I don't even have to think about it anymore. I don't have to worry about it anymore. I'm very thankful for the team of practitioners that I have when it comes to my gynecologist, my family doctor. I love her. She's retiring. I'm so sad. But hopefully the fellow that's taking over for her is also going to be fantastic. And I have a great naturopath, and then when conception happens, hopefully a great team of midwives as well. And I'm feeling very uplifted about this experience. I'm really glad that I was able to get my IUD out safely. They didn't have to go in surgically or anything like that. This has been a very frustrating process, but at the same time, it has not been traumatic, and it has not been anything too serious. And so I'm very thankful that the experiences that I had throughout sort of waiting to be able to start trying to conceive have been fairly and not super intense. So yeah, that was the experience of getting it taken out. It was much better than getting it put in, and it would have been even better had the strings not have been cut too short. The whole process would have been much easier if that were the case, but yeah, I guess we're gonna see what happens. I'm manifesting. I refuse to believe that we won't be able to get pregnant. I really do think that this is just the start, and I really believe that pregnancy is coming our way. I've done so much work when it comes to hormone regulation and preparing my body and being active and eating healthy and having a good mindset in regards to this. If you have gone through kind of a similar thing, or you're going to be going through a similar thing, I hope you have been able to find some comfort in my videos so far. And if you are kind of traveling on this journey with me, may the odds be ever in your favor. And I'm excited to see what's going to happen for us. I'm going to end this video here. If you would like to follow along on my perinatal journey, please subscribe to my channel. And like I said, there is so much more coming. So yeah. All right. I will talk to you guys soon.